We start tonight with a health alert. The Centers for Disease Control and Prevention releasing new information today saying a rare case of polio-like illness that has now been confirmed in 22 states. That includes some possible cases in our area. CBS 2's Dr. Max Gomez here right now with more on what you need to know. Dr. Max.
Well, Dana, it looks like polio, but it's actually poorly understood. Doctors suspect a virus in the polio family, but they really aren't at all sure. It can cause at least partial paralysis. There's no vaccine or even specific treatment.
I said, "Hey, buddy, can you lift your right arm?" And he goes, "I can't."
That's how it started for 4-year-old Orville Young. What looked like just a fever became acute flaccid myelitis, or AFM. At his worst, Orville was unable to move the upper part of his right arm and had difficulty moving his legs and sitting up.
He had an abnormality through his entire spinal cord.
The Centers for Disease Control and Prevention is reporting 127 patients like Orville are under investigation for AFM. 62 of those cases of the rare but serious condition have now been confirmed in 22 states. New Jersey has 3 confirmed cases and 3 more suspected. New York has no confirmed cases, but 2 are under investigation.
This is truly a mystery disease. We actually don't know what's causing this increase in cases. For some of the previous cases, we've identified one pathogen or another, but we have no unifying diagnosis.
AFM affects the central nervous system, specifically the spinal cord. Muscles and reflexes are weakened, and some patients are left paralyzed. More than 90% of cases are in children 18 years old and younger.
We first detected an increase in AFM in 2014 and then in 2016. So far in 2018, we're seeing a similar increase.
Doctors also don't fully understand why some patients with AFM have recovered quickly while others continue to have paralysis and require ongoing care. Now remember, AFM is still extremely rare. The CDC says the overall rate of AFM is about 1 in a million. But if your child develops AFM-like symptoms like weakness in the arms or legs, facial drooping and trouble swallowing or speaking, take your child to the hospital right away. As for prevention, that's hard to say because doctors aren't really sure what causes it. But if it does turn out to be a virus, then it's the same precautions you would take for the flu or a cold. Frequent hand washing, avoid sharing fluids and eating utensils with those who are sick, and avoid touching eyes, nose, and mouth with unwashed hands. Again, we're not really sure because it could be a whole variety of different things, but hand washing and those kinds of things, those precautions.
When you cough.
That's a good idea anyway, especially now that we're in cold and flu season.